Who are the community connectors?
So community connectors are a team of people. We're normally trained in something called health coaching, but we come from lots of different backgrounds. So some people come from health and social care, some people worked in other charities, and we're really just people that maybe have good listening skills, like to chat to people, and non-judgmental and friendly, and just here to work with people to see if we can offer any support or connect you to other services that might be able to help.
What do community connectors do?
So community connectors work with somebody that's referred to us. So that could be anybody, any adult. And we meet with that person, sometimes over the phone, sometimes over video like we're doing, but we like to meet with people face to face. And we get to know them. The first job is to kind of find out who the person is that we're working with. We ask them what matters to them rather than what is the matter with you. And we find out what issues they're dealing with. And then together, we come up with a plan to how we might solve those issues. So it might be that somebody might come to us and say that they're feeling really lonely and they're not getting out much. And we might work with them to find out why. And that might be where they're living. It could be they're in somewhere where there's no transport. But actually what they'd really like to do is meet other people and go for a walk. So in that case, we could look to maybe help them with some transport to go to a health walk, for example, and meet other people and have regular walks once a week, which might just help them feel better. So often community connectors will work with people who have poor health, might be feeling quite low, and might be going to see the doctor. And the doctor might say, actually, there's nothing we can do in terms of medicine, but what we can do is link you up with people that can help you in other places. And it might just mean that you need some time with friends and activities that make you feel a bit better.
How do community connects work?
So we normally meet with people for 5 sessions, and we offer them an opportunity to talk to us about the issues facing them. We come up with a plan with them. So they'll tell us the problem, and together we'll come up with a solution.
How does it start?
Well, for us in the Connected Communities team, it came from something called social prescribing, which is a term I'm not sure if you've heard of. But really all that means is that it was seen that there was a lot of people that were going to perhaps their doctor for help, for things that their doctor couldn't help them with. And actually what they needed was connections with other people, perhaps to take up a hobby, to do some exercise, to meet some needs somewhere else apart from at a doctor's or a hospital. And that really is social prescribing. So social prescribing started quite a few years ago and has just grown and grown and grown. And in Suffolk, we're doing quite well. We've got lots of different social prescribers.
Thank you for your time, Kayi.
Thank you, Joel. Lovely to see you.